Hi, and welcome to this 8th in our series of videos for frontline family violence workers and therapists during this complex time of COVID. Today, while we're always keeping in mind babies and children involved, we're shifting our focus a bit to talk about fathers. Now, this series continues to be a collaboration between several agencies and individuals, the details of which can be found on the Centre for Excellence in Child and Family Welfare website. And as always, we'll be giving you a link to a whole bunch of information and resources at the end of this video. First, we would like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to lands, waters and communities. We would like to pay our respects to Aboriginal and Torres Strait Islander cultures and to elders both past and present. So for this special Fathers episode, we have 3 new expert panelists who we'll introduce in just a moment. But first, we have a return visit from not just 1, but 2 of our regulars. So welcome back, Wendy and Coco, I hope.
Here she is. That just disrupted her snooze, but that's okay.
So if you'd like to introduce Coco and then yourself, Wendy.
Yes. So Coco, as you see, is here. Yes. And is my little offsider. I am a social worker, consultant and trainer, and very recently became formally an adjunct lecturer at La Trobe University.
Oh, congratulations.
Thank you.
Yeah. Lovely to have you back, Wendy. Thanks for being with us again. And Campbell Paul, who I've known for a long time, but first time meeting you in this context, Campbell.
Indeed.
Lovely to have you on board.
Thanks very much, Nick. Yeah, I'm an infant psychiatrist. I work primarily at the Children's Hospital in Melbourne, but also at the Women's Hospital and various other places. Excited at the moment, we're doing some training with MacKillop and Cradle to Kinder programs. And I'm also president of the World Association for Infant Mental Health. So had a lot of involvement and interest in infants and infant mental health for many years.
Just drop that one in, President of WAME. Congratulations.
Yeah. Thank you.
Lovely to have you, Campbell. Thanks for joining us.
It's a great organisation. That's why I mentioned that we've got local Australian organisation affiliates too.
Well, lovely to have you on board. Also lovely to welcome for the first time Monique Yeoman.
Thank you very much for having me. I work for Kids First in the northeast of Melbourne. I'm a social worker and have for the last 3.5 years been involved with the Caring Dads trial that has been running in Victoria. So Caring Dads is essentially a men's behaviour change program, but with a fathering lens. So focuses on repairing relationships between fathers and their children. So I'm excited to be here today.
Oh, well, thank you very much for joining us. Wonderful to have you. And Tim O'Leary, who's just reminded me, we have actually met once before, 18 years ago. So we apparently get together once every couple of decades. Tim, welcome on board.
Good morning. Good morning, everyone. Great to be here, Nick. And yes, I'm not sure what in 18 years' time the video series we'll be working on, but we'll wait and see for that one. Yes, I work
working with the elderly.
Yeah, thank you for that one, Wendy. Yeah. I can just see it now, the sunset years with Tim and Nick. It'll be a hoot. I have worked with Campbell and Wendy and studied with them and in the areas of infant mental health and family violence, and I'm the author of a book, The Dads Who Can, and the Relationship First Aid Kit. So I have an interest around relationships, engaging fathers, and my book for dads was an attempt to try and translate, I guess, ideas around infant mental health or the infant speaking to the father, and I used a variety of sort of visual means to do that, and I don't really have them here right now, so it's like talking on radio about a picture, but perhaps there's a way I can get them to some of the images to you, Nick, but essentially the idea that the more a father or a mother is looking through the eyes of the infant, then the connection is going to have a much greater sense of connection.
Perfect. Well, wonderful to have you with us today. My name is Nick Carr. I'm a GP writer and broadcaster. So it's now mid-September. There's blossom on the trees, spring in the air. Numbers are almost down to single figures. But for many families and workers, it's been a really long, cold and complex COVID winter. So let's kick off with a bit of an overview. I'm going to turn to you, Campbell, to start off talking about what do you see as the biggest challenges when working with infants and seeking to engage with fathers?
Yeah, thanks very much, Nick. I mean, the key question, as you bring up at the outset, is how to engage fathers, bring them into the picture of our work with infants and families. And it sounds simple, but I don't think it is. It requires, first of all, for us to think about the father of the baby. So often in our professional engagement with babies, with mothers in a maternity context or child health context, we don't even think about the father, and it's really crucial that we do. And that means acting on our thought. We need to be proactive in bringing fathers into consultations, into our mind, into the session. And paradoxically, I think, although we've got major social impact from COVID-19 and the restrictions that it imposes, it does present new opportunities as well. Often dads are at home and au fait with technology. So if we can use, first of all, the overarching driver, think about dads and involve them, and then look at the various ways we can use technology and new phenomena to build that.
So I want to pick up two things you said there and ask the others. But number one, you said we need to be more proactive. So turning to others, so what does that actually mean? What would that actually mean, being more proactive?
From my perspective, it's an interesting sort of dichotomy, because it's one of the things as an infant mental health worker you're trying to do is help people bring the baby into their mind, and babies often sort of get lost in family violence work because there is an assumption that, one, maybe they're not so impacted by the violence, and two, that their experience of violence or experience of frightening events is not remembered or understood in the same way as it is for verbal people or for adults. So it's a really interesting sort of dilemma where we are working very hard to help the baby come alive in the mind of the mother and of the father, or in same-sex relationships, both parents, whatever the configuration of the family is. But also, I think, building on Campbell's point, we also often neglect to think about how we bring men into the equation and honour the attachment that babies have with fathers, irrespective of what that father's behaviour is towards the infant or the partner. And I think that could be said for both women and men, but particularly men, where the numbers are excessively high around the use of violence. So I think it's a bit of a tricky constellation, and it really bodes well, I think, for people who think from a systems perspective, where we try and hold the whole system in mind as opposed to privileging one over the other.
So I suppose I'm thinking of myself as a frontline worker, thinking I completely get that, trying to get the men involved, trying to keep the infant in mind. I'm trying to think of actual practical ways. What does that mean in real life, in the work that they're doing on the front line? How do they do that? Any suggestions?
I mean, the first thing that comes to my mind is accessibility for men. Many of the men that we work with do work. And so we need to change our accessibility, how we operate as a system, so that we can access them and they can access us, essentially. So thinking about doing after hours work where we're able to cater to the hours that perhaps many men do work. I think that like at a real practical level, that's something that we can do and we can shift. I think that men generally, like has already been said, they really do want to be involved in the conversation. So bringing them into the conversation and almost thinking about how we raise the expectation also of dads in the family relationship, so that they're not just a secondary, but they are a primary contributor to the development of children right from the get-go. So the Safe and Together, I don't know if people have heard of the Safe and Together Institute and the Safe and Together framework, but that really talks to that, where the expectations of men need to be elevated to on par of the expectations of mums as well. And if we can flip our mindset to that, then we are, getting further ahead in how we can then be accessible to men.
I think, just to pick up on that, Monique, that it's a way of managing certain, certain sensitive areas, because just as we're asking the father to think about what the infant is needing or trying to communicate to the father, we're also asking the sector and the worker and the agency to have a certain clarity about what the infant might be looking for to this father, whilst at the same time holding on to the reality that this father may have behaved violently towards the mother, to the infant, or that there's been a frightening dynamic in those relationships, and having a way to hold both of those things. So kind of, from my point of view, it's really having that clarity of, well, how should the relationship be, and working back to, well, how is it right now? So it's not about being in denial about what's happening right now. It's not sugarcoating. We have a professional responsibility to be very clear and to see exactly what is happening. However, to have this clarity around, well, from a broader perspective, the research around fathers and father involvement is very clear. It's very solid. And it usually highlights that if a father can work in a cooperative way with the mother, then the child benefits. And if the same applies to same-sex relationships. However, if we're thinking about, that traditional arrangement, and then in this area, often you get separation, but then you get the couple coming back together, and it's quite a dynamic and fairly messy environment. But if we can have this clarity that the research shows that when the father is able to work in a positive, healthy, safe way, there are lots of benefits for the child, from educational, social, mental health, physiological. But when the father is violent or frightening, that there are, unfortunately, a huge amount of negative outcomes that are associated with that behavior. So from my point of view, it's engaging with the part of me that's wanting to really work hard to get this father on the path to a really strong connection with the child, where he is going to find through that relationship a level of meaning and purpose in his life, but also love, and most likely to have a sort of repair element, because there will be something in the mix, and this is not a justification for violence, but something in the mix that he didn't get from his relationship with his child, with his child, the inner child with his father, if that makes sense. And having said all of that, we're then, in terms of engagement, working from the macro to the micro. So from a bigger picture, it's around understanding the role and the importance of the father. But then at the micro level, it's around engaging a father to be quite reflective, which of course is a little bit in contradiction to the way many men are raised, where there's a disconnect between their emotions, their ability to reflect. So I think
it's interesting, that question of reflection. I wonder if men are as reflective as women, except that they don't have the general facility with expressing that. There's a lot goes on inside the mind. It's just, the problem is a lot doesn't go on in verbal communication. And I reckon starting early, starting in the pregnancy, is a really key thing. Building the dad into the whole process of the pregnancy, that there's a new person evolving right before his ears, his eyes, and grabbing hold of dads in the postnatal period in the midwifery context, even though it's really shortened now. It's a really key opportunity because they'll be there. I think that's one of the few opportunities where you're more likely to be able to actually meet the dad. You know they're going to be there in that period of the baby's birth in hospital.
And what are you going to do with the dads? So you've got them there, you've got them in that antenatal period.
Yeah.
So you mentioned sort of bringing it down to the micro to help engage fathers. So you've got the dad there. There's maybe some concerns that there's violence in the relationship, but the woman's pregnant. What's the micro? What are we going to do with these dads?
Well, there's a little bit to follow on from what Campbell was saying there around, well, during that period, there's an element of hopes and dreams, I guess, around being a father and meeting their child. And a lot of parents, of course, would recognize in the general community that nothing really prepares you for parenthood until you get there. But usually it's a time of hopes being quite alive. And it's a time where, because the baby hasn't arrived, there is this space to be reflective and to reflect on, well, what was your relationship with your father like? Or what was your childhood like? Or it might have been a grandparent. And I think, and I'm sure Monique and Campbell and Wendy will add to this, but it's a very sort of fertile environment in that regard. And it's around, from my point of view, I work really hard with parents prenatally with the idea of getting off to a great start. And for me, that means actually knowing very basic ways that the infant is trying to communicate to the parent, from as basic as tired signs to understanding mutual gaze.
I think one of the things is to actually, here's your baby. Make sure the dad gets to hold it, maybe, rather than feeling that he's got big hands, he's smelly, he's clumsy. No, that you've got you're there. This is your child right at the beginning.
The other component, I guess, because I think what you're asking, Nick, is, okay, that's the philosophy around it. What do we actually do in person? I think the answer for me is both and it's a both and to how we think about this. So there's a duality that we need to hold in our mind around expecting accountability for the safety of the infant and the safety of the family members. But there's also a way of doing that is engaging empathically with all people in the system. And I guess that's, in part, there are some things you can do to be very clear and overt and concrete about expectations and what is safe and what's not safe, and being even overt about the consequences to things. And that might be that if there are concerns that, as a practitioner, you will look at things like whether we need to involve child protection or we need to actually take some steps that mean that an external scaffolds put around this family to help them learn these new skills around being a safe family together. But the need within that accountability is to not be punitive, which, if you are punitive, replicates some of the historical intergenerational dynamics that have been handed down, but to have an empathic capacity to see the male in the family situation who you are concerned may be violent as somebody who themselves is struggling to try and make sense of the world and this new relationship and this new level of accountability and responsibility as a parent. So it's actually really complex work, and it's work where I don't think, for myself, I can only speak for myself, where I always feel like I know what I'm doing, because I don't always feel that I know what I'm doing. And I think in recent times, it's ironic that in some ways I'm actually working more with fathers now than I was previously. And I'm not sure if that's because of COVID and because fathers are at home or what that's about, but that I am. And I guess some of the issues that have come out within that domain has been about thinking really carefully around what systems need to be in place, or safety measures need to be in place, or safety plans as we're undertaking therapeutic work. So being really clear about how to do both and have a safety plan, having accountability, being really sure about the safety of the infant, but at the same time being very mindful of the relational opportunities that are there, and being very respectful and empathic as you engage in that sort of process. But that said, I would guess that we are going to find there's a lot of stuff that's been happening during COVID that doesn't come to light, and there hasn't been an opportunity to get into some of those families.
Yeah, so let's take that question about how COVID has changed things, because you're talking about the safety plans and doing this careful assessment. How has COVID changed how we do that? Monique, have you had much feedback or experience about how COVID has made us do things differently?
Well, personally, we have moved into, as we all have, I think, moved into the sort of online platform for doing the work that we do. There's definitely been far less capacity for outreach type of work, except for where there's, you know, been some quite significant risk from my understanding. I think what we've really been mindful of is, if we are going to be engaged with dads, particularly where we know there has been violence or there is risk of violence, we're making sure that we check in with the mums first, with the partners. When's a safe time to do this? Is it safe to engage with him? How should we do this so that we're not placing additional pressure on her? We're not potentially, you know, running the risk of actually elevating that risk again. So it does make it more complex. When we are engaging with him often at the moment, he's in the home, and there's sort of that there's less what we call decompression time, I guess. When we're working with him out in the community, he then has a bit of time to process what we've worked on with him before he, you know, goes back into the family home, whereas he might just actually be in the other room and come back out to the family. So we have to be really mindful of how we do this work, and the nuance to that, so that we aren't creating another opportunity or risk of further violence occurring. Yeah, it is like Wendy said, it's very complex.
Are there any advantages under COVID in that you can do it maybe more often and more rapidly because you don't have to arrange face-to-face meetings?
Definitely. And when we first went into this COVID, into the first lockdown, it was very frequent because there was just this whirlwind of change that was happening. So in order to be able to just offer some support to keep safe, to be a safe dad in that home, regular, weekly or more frequent appointments, to just, you know, keep working through that safety plan, troubleshooting any areas of issue that were arising. That many of the dads that we've worked with have really fed back that was really helpful and supportive in those difficult times.
I wanted to just reinforce something Campbell said that I think is useful to think about in this context, which is that some men do really struggle to be reflective, really struggle to articulate, well, maybe it's more they struggle to articulate their reflections. And one of the things that I've noticed in some family sessions is men walking out of the session, which you can easily do because just leave the Zoom.
Yeah.
And there also being some men not showing up to sessions because they've decided they don't want to do the work. And I think what's been interesting, because working with dads is not the primary thing that I do in my working career, but I do work with them. I think it is that thing, and I think this is something that Tim has done really well, is actually facilitate ways of visually manifesting a way of thinking and talking about feeling states that isn't the same way that women talk about feeling states. And women can generally wax on lyrical about their emotional states. Men, I think, really struggle to do that, and when they become overwhelmed, they then do decompensate.
So can we
Some
clarify?
men, not all men, not you guys. Yeah.
I think the difficulty is that...
What does that mean visually then, Tim? Can you
yeah, look, say for example, having a graphic of like a little gauge and helping the parent reading, hi Dad, you know, when I'm getting tired, I'll let you know, but you don't have to wait for the crying to know that I'm tired. And so that sort of appeals to the element of, you know, we all know that crying is an aversive sound and it stresses out a new parent. And so I might show you signs that you don't know, but you already know two of them. One of them is rubbing your eyes. The other one is yawning. So you've got two under your belt. But, you know, I might clench my fists, and, you know, you're not meant to know that that's a tired sign, but it really is. Or, you know, I might make a high pitched sound, and basically trying to lead the father to kind of have his eyes open to, oh my gosh, okay, so my baby is trying to communicate with me, but I don't actually know that language. And all parents have to go through this. This is not just dads with violence. This is all parents, you know, that it's a new thing to know that, okay, for the first 18 months, most of it's going to be nonverbal. And so I'm going to have to get my head around that, and that'll put me in a much better position. And, you know, I think that I just want to add two things here. One is that the ongoing thing around COVID is that where a worker might have had ways that they more comfortably engage fathers or mothers, that's gone. So there's an element of really, I think, as a sector needing to be aware of, COVID is asking challenges for workers as well as providing them opportunities. And we have to just be very mindful, I think, of worker self-care, burnout, those sorts of things amongst this landscape, that it's not just around, okay, what's COVID doing in our engagement with our fathers? Because if a worker is not feeling as robust from one day to another, that is the personal, but it will translate into the professional. And the thing around integration, around reflection, is that one of the difficulties is that there's so much shame and defensiveness around having used violence. And often a man will have a very compartmentalized approach to that aspect of his life. And so when you do ask a reflective question, if he has locked that away in a compartment, you're sort of, from your point of view, you know, the worker might be asking what they think is a really good reflective question, because you're basically saying, well, what triggered that, so that we can learn, so that next time there's that trigger, you can have a different response. So it makes a lot of sense to the worker. But from the father's point of view, he's maybe hearing it as, can we open that compartment so that we can shame you? Which is, of course, not our intention.
No.
So I think, to go back to that original question, establishing your engagement with the father is very, very important. The kind of the terms of what we're doing here, and just to put it in a simple metaphor that most people know, is we're trying to walk alongside this father. We're, as Wendy was saying before, trying to establish a non-judging, non-shaming relationship. But we have to be able to talk about the violence and the aggression. And so that means helping that father to see that, oh, this process is one where I'm not judged, but yes, my behavior comes under judgment.
I was just thinking how important it is to meet the baby in the context as well, even virtually. Where's your baby? Can I say hello? You just turn if you got FaceTime, just turn it around a little bit. Oh, look at that beautiful smile. But Monique, I'm wondering, how do you make sure that that's a safe thing to do when you're doing it by telehealth? What are the steps to make sure you've got a safe working environment for the dad, but especially for the baby and for the mum?
Yeah, well, we wouldn't necessarily, so we do a group program with dads. We're doing it over this sort of telehealth. If she is not comfortable with us doing that for whatever reason, we wouldn't engage in that group program. Yeah. So it very much is led by her. But we do also, we have some quite strong guidelines that we go through with the men around what the expectations are for them engaging in the group process. We have we've sort of we've made a few amendments to the group process so that and we do a long period of engagement with the men before we move into the accountability, responsibility type conversations, and that really is to do with the shame that Tim was speaking about before. If we don't have a good, strong relationship with the men that we're working with, then we're not going to be able to get to that place. It just feels too unsafe for them. But yeah, we've had to think about, well, if they're going to be in this group and we're having these conversations, what happens afterwards? We're not there to check in to, you know, if he feels a bit triggered and then leaves, what's happening? What are the things that we can put in place there? So we're having extra phone calls if we need to, etc., to connect more with him at that point, depending on where he's at.
Interesting, not so much in the context of family violence as such, but I know there's some really good programs that the Fatherhood Project out of Newcastle have come up with, the SMS for Dads project, where dads get a daily SMS message, how are you feeling, 1 to 5, and there's different categories. And if they're down in the pits, someone will give them a ring and say, how you going, bro? So there are programs like that, and there's a really good one for Aboriginal dads also coming out of Newcastle that's around in other parts as well for building that father's sense of I am a dad and this is my baby and I'm responsible, sort of proactive. But when difficult things have happened, then you've got a really complex scenario. I know I was talking to a mum who'd been in hospital with her baby, and there was a question of family violence, and I rang her for follow-up, and she was out walking with her baby, and I thought, oh, this will be all right. She's out walking with the baby. I was talking to her. And then she said, oh, my husband's just beside me here, walking as well. So it's a matter of, really checking the scenario, isn't it?
And it's also in COVID times, and we may be like this for a little while, it's those frontline workers and frontline services that really are in a better position for new cases. So cases where it's not known that there's been violence. So we're talking about existing programs and existing connections that maybe started before COVID. I think in emergency departments, maternal child health nurses, that's the sector that really is in a position to capture some of that stuff. And I'm not sure how well those systems are supported in doing that. And working in the setting you do, Campbell, I'm just sort of thinking, I know anecdotally that there's been a massive increase in women coming into emergency departments because of family violence. I don't know what's happening in those settings, whether there's any sort of additional response to reach out and make connections, or what that might be looking like at the moment.
Yeah, certainly there's increased referrals and actually a good number of families, mothers and babies and their dads, admitted for brief assessment, containment, and really careful planning for follow-up. That's compounded because of limitations on the number of people who can visit. So we've had some dads who've been turned away from the emergency department where we really need them to be involved in saying what the problem is, and then they're told you're not allowed in, and they get really angry. So some of our preventive things from the infectious disease point of view have been at times provocative as well.
Yeah.
I wanted to ask, because as someone outside of this frontline family violence, it's always seemed to me that a lot of the workers on the front line are female, and there's maybe this risk that the women feel a bit intimidated by men, a little bit avoidant of men, and perhaps particularly during this time of COVID, it's even easier to say, well, I'll talk to the mums, I'll talk to the kids, I'll dodge the men, because I find that a bit difficult or intimidating. Is that an issue? And if so, what do we do about it, particularly now that we're having less easy access to families face to face?
Yeah, look, I guess I think about that, and I think about this work as a journey, and that if your starting point is that you find that you're feeling intimidated. And again, this is the personal within the professional, and it's really valid. And it's very important to understand that it's okay to be feeling that way, and that there are many times where there can be feelings of fear and you know, just as long as the person can be trying to focus on their role rather than their feelings, that the role is really the guide here. But the feelings shouldn't be dismissed. It's very important. Sometimes because it's actually telling you about what's happening, you know, through the idea of countertransference, or just sometimes it's your gut trying to tell you something. But sometimes there's this, I don't know, particularly if you're a young worker, perhaps not trusting yourself, not trusting your feelings. But from my point of view, if we are trying to help the infant to have the experience of feeling seen by the father, as much as it's important for us to talk about strategies, and yes, I'm an educator, so I like using tools, but if this father feels kind of seen by the worker, then that engagement will be very strong. So I would wish to encourage the worker to be thinking, well, okay, I've got that fear, or I've got that anxiety. I'm going to put that to one side. I'm going to come back to what's my role here? What am I trying to do here? And how can I find a way to work from there and then engage with the father, which will really usually be around kind of what he's wanting. You know, what is it that you're wanting in your relationship with your child? And that becomes something that then allows that conversation to move into perhaps a landscape where it takes the worker away from their fear and allows them to move into a focus on the work we need to do.
One of the
two, Wendy, go ahead. Sorry.
Well, as one of the two females on the panel, I would say that it's imperative to keep thinking, keep reflecting in those spaces. I'm a pretty experienced worker, and I've worked with lots of men over my career, but I've been frightened at times. And I've also called upon male workers to help me. So I can think of times when I've deliberately asked for a male worker to be part of something with me. And more recently, again, doing that during COVID, I have had a man become very aggressive in a session, and I felt that was, you know, I felt really concerned. And then I went and had supervision and thought about it and tried to work out how to do this differently and to go to a different space with that. So I don't know, I guess blokes still get scared of other blokes, and women can be scared of other women. I think it's a process of moving from, that's that thing of mentalizing, that ability to sort of think about what I'm feeling and why I'm feeling about it and what it might have been telling me about that person, that they behaved in such a way that was meant to push me away and not let me get too close to anything. So I think remaining committed to supervision, reflection, talking to colleagues and working it out again as part of a collaboration of systems, it doesn't have to be you by yourself. You've got to reach out and ask for support.
And I'm sorry to cut across because time is getting away from us, and I want to finish with some practical tips if we possibly can. And I want one from each of you. I'm going to pick up on something Campbell said earlier. Campbell said beautifully, get the man to hold the baby. May not be great at the mentalizing and the reflective side of things, but physical side of things. And in the book I wrote for First Time Fathers, I recommended that the dad should always be the person who baths the baby right from the start. To have that unique experience one-on-one with the baby. Get the mum the hell out of there. He baths the baby. Doesn't matter if she slips under the water or eats the soap or something, it's his responsibility. And that regular physical contact, I defy any man not to fall in love with the baby when he's been doing that right from the start. So that's my little tip. Monique, I'm going to turn to you first. One tip for how to help the men engage with their babies safely.
I would say appeal to his self-interest. So 99.9% of dads want to be really good dads and have really strong, safe relationships with their children. So appeal to that and be curious about what it is that they want. That's going to be helpful in the engagement space. and helping him to achieve ultimately his goal.
Lovely. Campbell.
Yeah, I think talk with the dad about reparation when it's an appropriate moment. Life's been difficult for you, perhaps. How can you make it different for you now and for your baby now? We're really keen on the newborn behavioural observation. It's a really brief intervention for parents, and I reckon a very powerful one for dads, getting to know your baby right from the beginning, structured way.
Thank you. Tim.
Look, I think for me, it's around use of self. One of the things to bear in mind is that as a general rule, men are very status aware. So if they feel that a professional is talking down to them or that they're in a group being shown up in that negative light compared to others, it's very important to have a sense that what really works as a generalization, what works very, very well for men is to have a genuine connection. So I would encourage people to come back to really this idea of use of self. So rather than just sort of thinking, well, is there a magic kind of key that's going to open the door? Often the one that's going to open the door is that if as a worker, you tune into what's going on for me right now. And what I often do is I will say to a man, I'm really worried right now. I'm really worried about, I had a conversation last week. I'm really worried about your partner or ex-partner, they're on again, off again. I'm really worried about her mental health. And it's a way of me conveying how to talk about feelings in a constructive way. But I'm not saying you've been treating her bad. Yep. But it's a way to open up a conversation. And I'm using myself because I'm worried. And I think that people back yourself in, back what's going on in your heart and soul. The answer often is lying within you just as much as it's lying within him. So we have to bring that part more into the lexicon. And that's where this journey, the more you know yourself, the better you'll be at the work.
Lovely. Thanks, Tim. And Wendy, I'm going to give you last word to you and Coco.
Thank you. And I was thinking, geez, I hope everyone doesn't take all the answers. But I do have one, which is something that I like to do a lot, which is make that connection between past, present and future. So being able to talk to men about their experiences of their dad and their mum, but their experience of being parented and what it felt like during their childhood to live in the family they lived with, and to make connections between what that felt like for them with what they might believe their infant is already engaging with them around or feels about them, and then moving it towards the future and being able to explore how would they like it to be? How would they like their relationship to be with their child? And when they're older, for many men, they may not have a relationship with their parents or a very powerful one. And if they were to think about their baby now being a 25-year-old, how would they want to see themselves involved in the life of their 25-year-old daughter or son?
Lovely. Thank you, Wendy. Sadly, that's all we have time for today.
Except to promote the World Association of Infant Mental Health Conference in Brisbane next year in June, which you must think about going to. Right, Campbell?
Either in person or virtually. It'll be a hybrid.
Yep.
Excellent. So keep that in mind. World Infant Mental Health Conference next year in Queensland, either in place or virtually, or possibly a bit of both. That is all we have time for today. So thank you for joining us. Please stay online because we want your feedback. Leave questions that you would like addressed in future videos. And remember, you'll also find a whole host of valuable resources that our experts will put up there. They'll be available at this event page on the Centre for Excellence in Child and Family Welfare website. So that just leaves me to thank our wonderful experts who've given up their time today. Wendy and Coco, thank you. Campbell Paul.
Thank you.
Monique Yeoman.
Thank you.
And Tim O'Leary.
Pleasure. Thank you.
I've been Dr. Nick. Thanks very much for watching, and we look forward to having your company next time.